Hi, my name is Susie Holliday, and I am a licensed clinical social worker with Charlotte Behavioral Healthcare. And today I wanted to take a moment to talk about resiliency and recovery. A lot that they talk about in recovery is people, places, and things, and it can be very difficult to make changes because as people, we get used to what we're comfortable with, and even though it may be causing us issues, we may not necessarily want to make those changes. And so starting out small, making realistic goals for yourself so that it doesn't feel overwhelming. Custom made to what you need. Not everybody is going to be successful with the same tool. It depends on where an individual is in their recovery. Some people might do well with outpatient, just individual one-on-one counseling. A lot of people do great in a peer recovery, whether it's AA or Smart Recovery, Celebrate Recovery. There's a lot of different options in the community there as well. But the underlying premise is that sense of community, and you also get the accountability of other people that have similar experiences. And so you really want to make sure you get connected there. And it can be really easy to become overwhelmed if you have a lapse, if something happens and then you use and then you start to beat yourself up. It's really important to understand that lapse and relapse is a part of recovery. It's an expected part of recovery, and so you want to do the best you can to keep yourself safe and to keep yourself on track with your own goals. And it can be difficult. And I want to talk a little bit about Narcan as well, because right now we have an opiate epidemic. We do offer Narcan to anyone in the community that is in need of Narcan. There's no cost, no questions. I want to take a moment and share the different levels of care that an individual might engage in for their recovery. And what happens is, when you come in and you do an assessment, at that time they will do what is called an ASAM, and then depending on where that person falls on that ASAM, then it will determine whether or not you'd be a good candidate for individual therapy, or if that person would need intensive outpatient or detox or recovery center, either short-term or long-term. And it kind of just goes by the amount of negative consequences that come along with the using, whether it's physical or mentally or even spiritually. And so it really is specific to the individual. And we have people that have never struggled with substance use that are having difficulty with opiates, and it is across the board. It doesn't matter what age, sex, background. We are losing people, and a big part of that, especially here in Southwest Florida, is we might have a natural disaster like Hurricane Ian came through, and then you have people that even they may be older. You may have seniors out in the community that now they lack support and they don't have anyone to help them. They feel isolated, and so now we have that older cohort that is also struggling with opiates. So again, substance abuse does not discriminate. It can be anyone at any time. And so it's really looking at that person in that perspective of their humanness, and coming back away from that stigma, because addiction has nothing to do with willpower, has nothing to do with your moral standard, your character. What it has to do with is that person at some point had decided to engage in this behavior, and then the behavior has become problematic. And so again, it is a person who struggles with addiction, not a person that is broken in any way. So it's very important to make for sure that we're looking at other people through that lens of their shared humanity.